Ever get that feeling like someone smeared Vaseline on your glasses, but then you take your glasses off and it's still blurry?
Yeah, I hate that.
It's the worst. That could actually be something going on inside your eye.
Inside. Hmm.
Yeah, specifically with the vitreous humor.
Right, right.
And that's what we're going to be diving deep into today, vitrectomy surgery. So basically, it's a procedure to remove and replace the gel-like substance, that fills most of your eye. Kind of surprising, right? You probably don't think about that too much.
No, not really.
Did you know that the vitreous humor actually makes up like 80% of your eye's total volume?
Wow, 80%. That's way more significant than I think most people realize.
Yeah, it's pretty wild.
And it's not just some inert goo in there either. It's a really carefully balanced mix of different components like collagen, that helps give it structure,
Right.
and water for transporting nutrients.
Well, it's more than just gel. It's got a lot going on in there.
Exactly. The best way I like to think about it is almost like the scaffolding inside a tent. It helps the eye hold its shape.
Okay, that makes sense. So then what happens when that scaffolding gets damaged?
Well, quite a few things can actually go wrong. Have you ever, imagined a curtain suddenly being pulled over your central vision?
Oh, that sounds awful.
That's kind of what a macular hole can feel like.
Okay.
So it's basically like a small tear in the central retina.
Wow.
Yeah, or you could have a detached retina too, where the light-sensitive layer at the back of your eye, it actually pulls away.
Oh, that sounds pretty scary. So is vitrectomy the solution to these problems then?
It can be, yeah.
Are there different types of vitrectomy?
There are. There's posterior pars plana vitrectomy.
Okay.
That focuses on the back of the eye. So, things like retinal detachments or those macular holes we were just talking about.
Got it.
And then there's also anterior vitrectomy, which is a little less common. That one deals with problems at the front of the eye.
So let's say someone is experiencing one of these conditions. How do they even know if they need this surgery? Is it like a first resort kind of thing?
Not at all. It's a decision that's made very carefully, by the doctor and patient together.
Hmm.
They'll look at, the severity of the condition, like how much is your vision actually affected?
Okay.
Is it likely to heal on its own naturally?
Yeah.
And then, of course, the big question, do the benefits of the surgery really outweigh the risks?
And I bet cost is a big concern for a lot of people too.
Yeah, that's understandable. In the
Yeah.
U.S., on average, it can be anywhere from $8,000 to $14,000.
Boy.
Yeah. But the good news is, if it's considered medically necessary, insurance will often cover, at least a good portion of the cost.
Okay, that's good.
But yeah, it's always a good idea to talk to your insurance and get all the details.
So let's say you and your doctor decide that vitrectomy is the way to go.
Yeah.
What can you expect leading up to the actual surgery? What kinds of questions should you be asking your doctor?
I always think knowledge is key,
Right.
It can really help you feel prepared and ease those, pre-surgery jitters.
Absolutely.
Definitely have, like a really thorough conversation with your doctor. Make sure you ask about any fasting requirements. Will you need to arrange a ride home afterwards? Anything else that comes to mind, really.
And besides those practical things, what's the actual preparation like?
Well, you'll probably need to avoid eating for a certain amount of time before the surgery.
Okay.
And they'll usually give you some special eye drops, to kind of prep your eye for the procedure.
Okay, I think we're ready for the main event now. Let's get visual. What actually happens during the surgery?
It's actually pretty remarkable what surgeons can do these days. I mean, with the technology they have, they make these tiny incisions
Oh,
in the white part of your eye to get access to that vitreous humor.
and they actually remove it,
Yeah.
like all of it.
Yeah. They use a specialized instrument and they very gently, remove that damaged vitreous.
Wow.
Then, depending on what the problem is, they might use a laser,
Oh, wow.
to repair a retinal tear or maybe reattach the retina.
So they're using lasers inside your eye.
Yeah. Pretty incredible when you think about it.
Yeah, it sounds kind of like science fiction.
A little bit.
So then what happens to all that empty space where the vitreous was?
Sometimes they'll inject a gas bubble or silicone oil
Okay.
just to kind of help hold the retina in place while it heals. But don't worry, those are only temporary. They'll eventually get absorbed by the body.
So you're not just like waking up from surgery with perfect vision then. What does recovery actually look like?
Yeah, it's definitely a process. Usually it takes, around 4 to 6 weeks.
Okay.
And you might experience some blurry vision for a few days, some redness, or maybe a little bit of a scratchy feeling.
I've also heard of people having to lie face down after surgery. Is that a real thing?
Yeah, it's not a myth. If they used a gas bubble, they'll have you lie face down
Oh, wow.
for a certain amount of time each day just to help position the bubble correctly
Oh, well,
so that it can, support the retina while it's healing.
I bet that's not super comfortable.
No, not the most comfortable, but it's only temporary, and it's really crucial for a good recovery.
So how many follow-up appointments do you usually need?
Quite a few, actually.
Oh, and
To monitor the healing process and make sure everything's on track.
yeah.
Usually they want to see you the day after surgery.
Okay.
Then again at 1 week, 2 to 3 weeks, and then, a little less frequently over the next few months.
Now, we've talked a lot about the benefits of vitrectomy, but let's be realistic. There are always risks with surgery. What are some of the potential complications?
It's true, yeah. It's always important to be informed. Even though vitrectomy is successful about 90% of the time, there are some potential risks.
Right.
Things like bleeding or infection, or even, in very rare cases, vision loss.
So the key takeaway here is be sure to have those open and honest conversations with your doctor.
Definitely.
Carefully weigh those risks and benefits and be prepared for what that recovery process might look like.
Exactly. And it's worth mentioning that, the field of ophthalmology is always evolving. There are some really exciting new treatments being explored that could, totally change the landscape of vitrectomy in the future.
Or you mean like there might be alternatives to this whole process down the road?
Exactly.
Tell me more.
Well, there are some pretty promising advancements like laser photocoagulation
Okay.
for treating things like diabetic retinopathy, which, is one of the leading causes of vision loss. So instead of removing the entire vitreous, they use a highly focused laser beam, and they basically seal off those leaking blood vessels in the retina.
Oh, that's fascinating. So it's more targeted. They're just addressing that specific problem area.
Yeah, exactly.
What about ultrasound? How would that be used?
Ultrasound's really cool because it could actually allow surgeons to break up scar tissue or even manipulate delicate tissues with way more precision during the procedure.
So potentially less invasive procedures, quicker recovery times. That sounds pretty amazing.
It really does have a lot of potential.
Well, let's not get ahead of ourselves.
Yeah.
What are your thoughts on all of this, listener? What stands out to you about these potential advancements?
This is where it gets really exciting, I think. We're talking about less invasive procedures, faster healing, and maybe even, preventing vision loss entirely. It's a really fascinating time to be, following this field.
Absolutely. We'll be back after a short.
Yeah, it really is remarkable how much these advancements could, potentially impact people's lives. We've been talking a lot about the technical side of things,
Right.
but it's important to remember, just how much we actually rely on our vision.
Every single day, yeah.
Yeah, every single day.
It's one of those things that you don't truly appreciate until it's, threatened in some way.
Exactly.
Like driving, reading, even just recognizing people's faces.
Even enjoying a beautiful sunset.
Yeah.
All of it depends on healthy vision.
And for people who are experiencing those conditions,
Yeah.
like the retinal detachment or the macular holes, it's not just an inconvenience.
No, it's not just an inconvenience.
It's potentially losing their independence and their quality of life.
Absolutely. And that's where a procedure like vitrectomy can really be life-changing.
It's literally restoring people's sight.
It is.
And while we did talk about the potential risks, that 90% success rate
Right.
is definitely reassuring.
Absolutely. And even with that high success rate,
Yeah.
researchers are constantly working, to make the procedure even safer
Of course.
and more effective.
Which brings us back to those alternative treatments
Yes.
you were talking about.
Yeah.
Laser photocoagulation, ultrasound, what makes them so promising?
Well, with laser photocoagulation, it's already showing, really great potential in treating diabetic retinopathy,
Okay.
which is,
One of the leading causes of vision loss.
yeah, one of the leading causes.
Yeah.
So instead of removing that whole vitreous, they use this highly focused laser beam
Okay.
to basically seal off the leaking blood vessels in the retina.
So it's like a more targeted approach then?
Exactly. It's
Yeah.
much more
We're
targeted,
going right to the problem area.
right to the source.
Okay. And what about ultrasound? How would that even be incorporated into vitrectomy?
Well, ultrasound is really fascinating because it could potentially allow surgeons to break up scar tissue
Wow.
or even manipulate those very delicate tissues
Yeah.
with even greater precision during the procedure.
It's amazing to think about all this technology and how it's constantly pushing the boundaries of what's possible
Yeah, it's really incredible.
with eye surgery.
It's not just technology, though. Oh, okay.
Our understanding of the eye itself is always evolving.
Yeah.
And, there's a growing interest in the role of inflammation
Okay.
in eye diseases.
Inflammation, I usually think of that more in relation to like injuries or infections.
Right.
How does that play a role in eye conditions?
Well, it turns out that chronic inflammation can actually contribute to conditions like macular degeneration
Oh, wow.
and diabetic retinopathy.
Okay.
So researchers are,
That makes sense.
looking at ways to target that inflammation
Yeah.
and potentially slow down the progression of those diseases.
So it's not just about fixing the immediate problem.
It- you know, I-
It's looking at what's causing it in the first place.
It's a different way of thinking about treatment.
Yeah.
It's more like
Proactive versus reactive.
exactly,
Yeah.
yeah, a shift from reactive to proactive.
Okay, I kind of want to shift gears a little bit and talk about like what happens after someone has a vitrectomy.
Sure.
What does recovery actually look like? Well, recovery is gradual,
Okay.
and it's really important to, follow your doctor's instructions very carefully.
Right.
And that means using the prescribed eye drops, avoiding anything too strenuous,
Right.
and absolutely no rubbing your eye.
Oh, I bet that's hard.
Yeah, no matter how tempting it might be.
I can imagine.
Yeah.
What about those patients who have that gas bubble inserted?
Right. Well, that face down positioning,
Yeah,
it can definitely be a challenge,
I can imagine.
but it is temporary.
Right.
And the benefits outweigh the discomfort. It's
Mm.
really essential for proper healing.
How long does it typically take for someone to see clearly again?
It really depends on the individual and the complexity of their surgery.
Okay.
Some people, notice improvement within a few days,
Uh,
while others might take several weeks or even months.
wow.
So patience is definitely key.
And those follow-up appointments that we talked about,
Yeah.
what actually happens during those?
They're really vital for monitoring your healing and,
Making sure there are no complications.
making sure there aren't any complications.
Yeah.
Your doctor's going to check your vision, examine your eye,
Yeah.
answer any questions you might have.
So it's like an ongoing conversation.
Yeah, it should be.
A chance to really address anything that comes up.
Exactly.
What would you say are some of the long-term benefits then of having a vitrectomy?
For a lot of people, it means regaining that lost vision
Yeah.
and getting back their independence.
Yeah.
They can go back to doing the activities they love, reading, driving.
Living their lives.
Yeah, just spending time with loved ones.
It really is about, restoring their quality of life.
Absolutely.
Not just addressing like a medical issue.
You said it perfectly.
Yeah.
That's what makes this field so rewarding,
Yeah.
knowing that we can really make a difference.
Are there any lifestyle changes that someone might need to make after vitrectomy?
It really depends on, the individual and the reason for the surgery.
Okay.
Someone who had surgery for detached retina, for instance, they might need to avoid things like jarring movements,
Okay.
contact sports.
So no bungee jumping.
Probably best to stick to some gentler activities for a while.
Okay.
But in all seriousness, your doctor's going to give you very personalized guidance
Right.
based on your specific situation.
We've covered, the physical aspects of
Right.
recovery.
Mm-hmm.
But what about like the emotional side of things? I imagine going through this whole process can be pretty stressful.
It absolutely can be.
Yeah.
It's important to remember you're not alone.
Yeah.
Lean on your support system. Talk to loved ones.
Right.
Maybe consider joining a support group or even seeing a therapist if you're feeling overwhelmed.
It's okay to ask for help
Absolutely. It's more than okay.
during challenging times.
Yeah. There are resources out there and people who really want to help you through this.
This has been like an incredibly informative deep dive so far.
It has been.
We've learned about, the anatomy of the eye,
Yeah.
the intricacies of this surgery,
Mm-hmm.
the potential risks and benefits,
Right.
and we're not even done yet.
That's right. We still have a lot more to discuss.
We've only just scratched the surface.
Yeah, the future of this field is really exciting.
We'll be back after a short. Welcome back to our deep dive into vitrectomy surgery.
We've really explored this procedure from all angles.
It's been fascinating. But before we wrap up, I think it would be helpful to go over a few key takeaways, for our listener.
Definitely. I think one thing that really stands out to me is just how complex the eye is.
Yeah.
Despite its size, there's so
Right.
much going on in there.
And the vitreous humor. It's something most of us probably never even think about,
Hmm.
but it plays such a crucial role.
Absolutely. In maintaining healthy vision, yeah.
Yeah. So when something goes wrong with it, like with retinal detachment or a macular hole, vitrectomy can really be a sight-saving procedure.
It really can. It's incredible what surgeons can accomplish these days.
It really is. But like we've discussed, it's not a decision to be taken lightly.
Right.
It's important to have those open and honest conversations with your doctor.
Definitely.
Weigh the risks, the benefits, and really be prepared for that recovery process.
And know that technology is constantly evolving.
Yeah. And those new treatments that we talked about,
Right.
like laser photocoagulation and ultrasound, they offer so much potential, for less invasive options down the road.
They really do.
So what does all this mean for you, listener?
I think it means knowledge is power. The more you understand about your own eye health, the better equipped you'll be to make those informed decisions.
And don't be afraid to advocate for yourself.
Yeah, absolutely.
Ask questions, seek out second opinions if you need to, and find a doctor that you really trust.
Exactly. It's your vision, your health, and you deserve to be a part of that decision-making process.
We hope this deep dive has given you a good foundation of knowledge about vitrectomy surgery,
And maybe sparked some curiosity.
about the future of eye care.
Yeah.
But like we've emphasized, this is just the beginning. There's always more to learn and discover.
Absolutely.
So what are you going to explore further? What questions are you going to ask your doctor at your next appointment? What possibilities for the future of eye care really excite you?
Keep learning, keep asking questions, and keep advocating for your own health. When it comes to your vision, the future is bright, and it's being shaped by these advancements that are happening right now.
Thanks for joining us on this deep dive into vitrectomy surgery. We'll see you next time for another fascinating exploration.